How we change attitudes to hearing care. If you've seen the presentation on where our attitudes to hearing care come from, then you recall that we began to think about what we should be doing in order to modernize people's attitudes towards hearing care. We saw that people are not born with these negative attitudes, but instead they learn them along the way by the things that they see, the things that they hear, the things that they do, and the things that they feel. And so it turns out that very often it is those of us involved in hearing care who shoot ourselves in the foot, because many of the messages we present, and the words that we use, and even the way that we deliver hearing care actually help to reinforce those old-fashioned negative attitudes and stereotypes that make our jobs harder. And so if we're serious about reaching the 4 million individuals living amongst us who would benefit from hearing aids, but still haven't done anything about it, we need to learn how to become instruments of change. So that's our starting point for this presentation. How do we go about actually changing people's attitudes towards hearing care? So let's get started with a picture of teeth. Recently, my teenage daughter was fitted with a pair of braces. It was something she'd been looking forward to for many months. And I thought this was rather curious, because I remember at school the idea of having braces was something you wanted to avoid. So I wanted to find out whether my daughter's attitude to braces was something peculiar to her, or whether it was part of a wider trend. So when I asked her about it, she explained that people at school see wearing braces as a cool fashion accessory, and every time she goes for a checkup, she even gets to choose a new colour. But this attitude isn't just found at my daughter's school. According to a recent study, 15 to 17-year-olds were shown as being the most favourable to wearing braces, with 1 in 4 saying they would definitely benefit from teeth straightening. So here we see something that, in the past, has attracted a negative attitude, but now attracts a positive attitude. If we had time, we could perhaps look at the reasons for that change in attitude, because there are many lessons here that we, in hearing care, could learn. But there are just 2 things I want to highlight. Firstly, attitudes towards negative things can and do change, and often very quickly when the factors are right. Secondly, attitudes govern our response towards something. Do we avoid it, or do we approach it? And this is a universal principle when it comes to attitudes. Avoid, approach. Avoid, approach. Avoid, approach. Avoid, approach. What we saw there were some examples of different types of attitudes. Some attitudes are related to things that seem to be built into us as humans. For example, we avoid threats, like the vicious dog or the angry face. But we approach things we find cute or attractive, like the puppy or the smiling woman. Other attitudes might be determined by what society expects of us, such as recycling versus landfill. And sometimes we can each have different attitudes towards the same thing, as we see here with the smoking. Attitudes often express how we see ourselves and how we view our own place in the world. Of course, attitudes aren't always so extreme as simply avoid or approach. They tend to fall along a scale. At one end we have very positive, at the other end we have very negative. The more positive our attitude towards something is, the more we like it or are favourable towards it, so the more we're likely to approach it. The more negative our attitude towards something, the more likely we are to avoid it. But here in the middle, we have a neutral attitude, where we haven't yet made up our minds about something. So let's see how this applies to hearing care. If I was to ask you where you thought the general public's attitudes to hearing care fell along this scale, where would you put it? Would you say that people's attitudes were more positive, around here? More neutral, around here? Or more negative, around here? Well, it turns out that the way attitudes work is that most people don't really know or even care what their attitude is towards something until that attitude needs to be put to the test. So until an attitude is put to the test, it's not normally fixed, and so it can be influenced or shaped. But once the attitude starts to take shape, it becomes much harder to change. So it's important that we remember that this principle applies to hearing care too. You see, those of us working within hearing care often get the impression that most people out there are fairly negative towards hearing care. But the good news is that most people's attitudes are actually far more likely to be fairly neutral, simply because they've got no real reason to care one way or another about hearing care. But once that attitude is put to the test, that's when their attitude to hearing care will start to take shape. So we need to understand how this happens. Let's start with how an attitude might be put to the test. Well, someone might ask our opinion about something. Or we might be asked to make a judgment between several things. Or we may be asked to carry out an action or behave in a certain way, such as voting on an issue, or whether or not we recycle something. At this point, people ask themselves, how relevant is this to me? How is it going to impact on me? What are the consequences? The less relevant it is, the less effort we'll want to make in formulating an attitude. So we'll be looking to take mental shortcuts where we can. But the more relevant it is to us, the more effort we'll be prepared to put in, just to make sure we're satisfied with our attitude, because we know that the consequences of holding that attitude is going to have a direct impact on us. As an example, if we were to read of a wonder drug that could restore hearing in 95% of cases, it's going to be far more relevant to us as hearing care professionals if it becomes available within the next 6 to 12 months than if it was only theoretically to become available in the next 20 years. If such a drug was imminent, we're going to be much more motivated to make an effort to work out our own attitude towards it, because we need to know how to respond. Our attitude towards it will have a direct impact on us. So when something isn't particularly relevant to us, then we tend to use these ready-made attitudes. In other words, we look for a pre-packaged attitude that's there for us to use straight away. And the basis of these ready-made attitudes can be incredibly flimsy. For example, we might see what the crowd is doing, on the basis that if the majority are doing it, they can't all be wrong. Or we might follow our peers, or the people we think are most like us. Or we might follow what the experts tell us, on the assumption that they know what they're talking about. We may even ignore the content of a message and follow it simply because we find the messenger attractive or funny. Or we may simply transfer the way we're feeling at the time onto the message itself. So if we feel good because the sun is shining, or we've had a good meal, even this can affect our attitude. Attitude formation can be this flimsy when people use ready-made attitudes. By contrast, when something is relevant to us, then we're going to formulate our attitude from raw ingredients. We're going to look at our thoughts, our feelings, our actions and behaviour, as well as what people expect of us, especially the people we value. So understanding relevance is very important if we are to change attitudes, because it directly affects how that attitude can be shaped. To most effectively change attitudes, we must be relevant to our audience. But at the same time, we need to be aware that the messages we present, the language we use, and the way we provide hearing care can also help to shape those ready-made attitudes, and they're every bit as important because they often form the social norm,